Hi, it's Dr. Sweeney here today to talk about depression. Now, depression is a syndrome where people can feel very low in mood, very withdrawn, often very physically slowed down as well and mentally slowed down. You often, as depression progresses, can lose interest in your physical appearance and self-care. People's appetite can change either upwards or downwards. And it can sometimes be associated with anxiety as well, which is feeling nervous and anxious all the time. Now, depression can affect anyone. Even if everything in your life is going perfectly well, it can make you feel very down. Often the mechanism is these automatic or intrusive negative thoughts pop into our head. Now, these thoughts are not what we want to happen. They are actually our worst fears. They're trying to traumatize us. They're trying to pull us down, make us get into this fight with the negative thoughts, to argue with them and pull us downwards, exhausting us more and more. And as it gets more and more intense, we get more depressed. Now, it's important that you do speak to friends and family or relatives, people that you trust about this, and then onwards to a healthcare provider who can then involve a psychologist for talking therapy or even a psychiatrist depending on the severity. So talking therapy is a big part of depression, understanding why you're having these negative thoughts, how to recognize them, and how to allow yourself to let them go. Because you are allowed to let them go. They're often our worst fears, but it doesn't mean that you're going to do these things or that these things are going to happen. Along with depression, there can be sometimes suicidality, thoughts of harming yourself as well. This is all part of it. Your brain is trying to upset you, is trying to frighten you. So it's good just to acknowledge these thoughts are there, but to recognize all these negative thoughts as being part of the depressive illness, and to talk about them and to let them out, recognizing that, as I said, they are our worst fears, but you can let them go and just relax and breathe, talk things out, and focus back on the present. As well as medication and getting the right talking therapy, exercise and healthy diet can all play really, really vital roles. But the biggest thing about depression is just talking about it, knowing that you're not the only one, that it's very common, it can affect anyone at any time, and it's not your fault. So at any point, if you're ever struggling, please don't be alone. Reach out, talk to people, be honest with them that you're feeling quite low and down, and explain things to people that you trust, and then set about getting help. Please don't suffer in silence. Until next time, see you soon.